So we're talking about some complications of pregnancy, and we spoke about things like preeclampsia. So preeclampsia, we said that the woman, the hypertension is high, or the blood pressure is high. That's hypertension, right? Then what again? We said she's passing out proteins in urine. Then we said that this condition could actually escalate to a more severe condition, which is known as eclampsia. And we said that in eclampsia now, there's a type of seizure that comes up. Do you understand? So that's what they call eclampsia seizure. So let's look at it so that there are different types of seizures. So when you look at the characteristics of the type of seizure seen in eclampsia, it will help you to now be able to differentiate it. You understand? First of all, you should know that this type of seizure will be seen in somebody that is pregnant. But even somebody that is pregnant can come up with different type of seizures. All right. So how is this very seizure like? So it's a life-threatening complication of pregnancy. It's marked by onset of generalized seizures in someone that has preeclampsia. Do you understand? So that's a condition. The preeclampsia, the person is having high blood pressure and the person is passing out proteins in urine. Do you understand? So before you can actually confirm that a type of seizure is an eclampsia seizure, you must check it that the person's blood pressure is high. You must also check it that there's proteins in urine. Okay, you understand? So what happens during eclamptic seizure? All right, that's how they call it. There's tonic-clonic convulsions, so sudden muscle stiffening followed by rhythmic jerking. There's loss of consciousness or confusion, maybe preceded. That's like before it came, the woman might have been complaining about headache. She has been complaining that maybe she has not been seeing well. She has been complaining about pain in the upper parts of the stomach. All right, swellings in the hand and face. That's what accumulation of fluid as edema. You understand? The high blood pressure. Do you understand? So you have to take medical history, because you want to pinpoint at least 3 of these points. Okay, I'm not saying all of them must occur in one person. All right, if you pinpoint like 3, it's cool. You understand? All right. So causes and risk factors, like what could cause a seizure in eclampsia, is progression of preeclampsia. So she had preeclampsia, that's high blood pressure and proteins in urine, and it wasn't addressed, so it progressed. Can occur without prior signs of preeclampsia in rare cases though. So risk factors, like it happens mostly in people that this is their first time being pregnant, so their body is just getting used to the whole condition. If you have many babies, twins, triplets, if your age is too young, or if your age is the one that you're approaching menopause. Okay, if you have had history of having hypertension as a separate disease, having kidney issues as a separate disease, having diabetes as a separate disease, that means the diseases are not coming in because of pregnancy. You understand? So management is magnesium sulfate. It's the first line, right? It's to prevent, control the seizures. Blood pressure management. Okay, that's all those antihypertensive drugs. Then delivery of the baby, because the baby is the one causing it, right? So the baby is delivered, the problem the baby is causing is gone. You understand? Then supportive care, like giving oxygens, IV fluids, fetal monitoring, to see that there's no problem with the baby.